Welcome to the Digital.Health Studio Series. We are overjoyed to welcome all of you to our program today. I am Risa Vatanka, co-founder and CEO of Digital.Health, and I am here with my co-host. There he is, the incredible Dr. Daniel Kraft, the founder and chair of Digital.Health and NextMed Health, physician, scientist, futurist. And we are here at Digital.Health on a mission to accelerate adoption of digital health and AI technologies to really usher in this new era of health. And our studio series, well, Daniel, are you excited for this next session?
I'm always excited, and I think this session kind of is at that super convergence of where digital health can take us. So excited to have the conversation.
Yeah, absolutely. And we've got a stellar lineup of brilliant leaders again this episode. At Digital.Health, we created the studio series to establish a space where innovators, digital health solution providers can share how they're designing and developing digital health technologies. And it's a place where thought leaders can help us connect the dots on the value of these solutions, really integrating in person and virtual care anytime, anywhere. And importantly, the Digital.Health Studio Series is a place where we can hear from clinicians and people with lived experience, sharing how these technologies are really addressing unmet needs. I want to say a really big thanks to our Digital.Health community, to our ecosystem partners, our Growth Catalyst members. Special thanks to SignSpeak for offering our sign language interpretation services today. We're delighted to offer that along with closed captioning. And here's the format. So each episode, we begin with what's new and what's next in health and tech. And then we have our featured guest present insights and initiatives they're engaged in. And then we deep dive into the panel discussion. And today's discussion will be on digital health for all, really bridging that accessibility gap. And we have the Q&A open. So we really encourage all of you to ask questions, post comments in the chat, and our panelists will try to answer them in real time. Otherwise, we'll save time at the end for Q&A and closing remarks. So here we go. Without further ado, Daniel, you are always traveling the globe. Sometimes you're a passenger on a plane. Other times you are the pilot. And so as you travel, you get exposed to so many interesting technologies and get to really experience a lot of them firsthand. So we'd love for you to share with us what's new and what's next in health and tech. Take it away.
Great. Thanks, Risa. Thanks to you all for joining us today. I'm just going to sort of try and do a mad dash through some of the art of the possible. And as I travel and even stay local, I think what's exciting about the future of healthcare writ large and the convergence of digital and AI and beyond is that it's making healthcare more accessible for all. And that's what we're going to talk about overall today. It's also a challenging time in health and medicine for a variety of reasons, but I love this quote. The pessimist complains about the wind, the optimist expects it to change, the leader adjusts the sail. And we have a whole new set of winds pushing our sails today, some of which we'll talk about in depth. Some we'll just touch briefly on that are pushing our sails or have this opportunity to guide our ships going forward. And of course, we're in the era of AI and GPT all moving very, very quickly. Even the poorest on the planet have access to magical AI and apps on their mobile devices. And of course, the power of AI and let's say medical diagnostics in terms of price and speed and performance is getting more and more incredible. And I think we're finding ourselves in a place where the future is coming faster than we think. And I think as we are health innovators in digital health and beyond, we need to think about that arc of the possible and moving it forward to bring access and equity for all. And we have tons of challenges, whether it's in the US or beyond, let alone with the shortage of clinicians, but to the shortage of access to many elements of health and medicine. And this sort of digital area can sort of bridge that gap. Of course, one of the exciting areas that's moving quickly in the AI space is this idea of agentic health. I think when we talk about health access and equity, the opportunity for technologies to meet people where they are based on age, culture, language, personality type, in this sort of multimodal way really can unlock this new era of self-care, the ability to connect with an avatar that matches you, based on who you are, your family dynamic, your language, your culture. I think that's going to be more and more powerful. It's still very, very early days there, but that could give people access to not just their data, but the insights and what's actionable around that for themselves and their family and their communities. And so the future of hopefully digital health and beyond is that it's a bit more intelligent, more digitally enabled, connected, but at its core, more accessible and equitable and democratized. Everyone has, not everyone, but more and more folks have access to their digital tools in their pockets. The challenge is, how do we leverage these tools to take us from where we are sort of now, our intermittent reactive sick care model, to a future that's more health focused, leveraging the digital data and insights in a much more crowdsourced manner that is enhanced with AI, but not replaced by it. And so we have all new set of tools. Many of the folks on the call and the audience are building them at the sort of super convergent technologies. And as we'll talk more about today, this gives us the opportunity to sort of reimagine the art of the possible for today and the next 5, 10 years, and improving access and accessibility for these unmet needs and current ecosystems. So I think one meta theme is that we're all sort of now moving into near a bit more, not just healthcare or sick care, but self-care. Folks can be uh, ordering their labs online, accessing mental health, downloading digital therapeutics. It's a time of shift and change, but of course, it's not equally distributed. And we're hopefully going to move with all this as a sort of era of intermittent reactive sick care to the future that's much more proactive, anytime, anywhere, and can deliver us better outcomes at lower cost and in a more accessible, equitable way. So speaking of, the terms we're all familiar with, social determinants of health, or whatever we want to call them, we know that technology, which we're going to be focused on, is important, but the sort of social elements and the way we connect to our technology is often the critical element to improving health span and lifespan. And sometimes that's the technology stack. Of course, we're all, searching for Wi-Fi and improving our battery life. Sometimes that's almost the bottom of our Maslow hierarchy. Of course, now who has access to internet, that's changing. 50% of the world population still doesn't really have internet access, but that's moving quickly with satellite-based systems, including many parts of the United States, rural and otherwise, and very some poor or no connections at all. So when we're thinking about access, equitability, et cetera, sometimes it's about understanding our data, making sure it comes from equitable and distributable populations, whether it's looking at pharmacogenomics or disease elements. I love the All of Us research program. Hopefully that survives all the funding changes. That's encouraging folks to share their data, their health experiences, and their journeys to sort of build a better map for all going forward. And as health becomes more multimodal, those data stacks, and as we converge them together, are going to be more and more critical as we build digital twins that are representative. The most sort of accessible technology for most that's touching all of us in healthcare, of course, is the mobile smartphone. Even the lowest, even folks in the least opportune elements often have access to these technologies. I think what's powerful there is they become these modalities for which we can access this new world of sort of agentic or avatar-based health. We can interact with things that we are sort of virtual beings that we know aren't real, but can match our personality types, what's going to sort of nudge us in the right directions. That could be for mental health. It could be for scheduling follow-ups. It can sometimes be framed in the wrong way. I think we're not going to replace nurses with avatars, as some companies like to do, but it does give us the opportunity to interact and meet people where they are in formats that weren't possible in the past. And of course, diagnostics is becoming more accessible. It could be from your camera that can pick up your vital signs. It can be from low-cost wearables that are, becoming democratized as well. It can be using voice as a biomarker just from your microphone. And sort of this explosion of wearables and otherables is sort of opening up the aperture for collecting data, but making it more and more useful. And as Google research has published, we're in this era of or sensor LM to sort of integrate that and make it contextually available to the point where, again, you're going to start getting messages to you in your language and ways you respond about your clinical issues or ways to stay healthier, proactively built exactly for you. So a lot of exciting tools are in the works. We're going to see in the next couple of years the ability to do real-time blood sugar and real-time blood pressure just on your wearable devices without squeezing without a cuff or without taking any blood. Of course, these need to be designed for different skin colors and others. There's been issues with that came up during the pandemic for, let's say, pulse oximetry. So making sure these match different sorts of populations. The future will be sort of these continuous data forms made contextual, everything from managing pregnancy to hypertension to diabetes to mental health. So it's an exciting time to integrate these tools together and democratize how they're accessed. So briefly, where this is going to be in the next 5, 10 years, we're going to enter the era of the sort of the digitome and multiomics, continuously parsing of our data. That means you can take this to different places. There's a famous example of the for in the African American population, the barbershop model for screening for hypertension. You can imagine the near future where the barbershop can be a place where all sorts of sensors, maybe even labs, can be done at very low cost to improve access and equitability. And now we're seeing the advent of these sometimes leapfrogging the United States. I'm on the board of a company called Jivi.ai, which has already built sort of your personal healthcare multi-agent, not just for the sick care side and triaging you for appendicitis, but building out models for diet, nutrition, mental health, and beyond. So these are early examples, sometimes outside the U.S., that are improving access and care where often there was very little or was not cost it was cost prohibitive. And finally, of course, digital health is that sort of connective tissue, blending with AI today, digital therapeutics, for everything from smoking cessation and beyond, kind of starting to connect those dots and communicate that to folks in the ways that matches their elements. And of course, at Digital.Health, we've been building this platform where you can find, learn, share care of these technologies. It could be around diabetes care. It can be around equity. It could be around, as we're going to hear about, hearing and other technologies. Please search for, use the database, add your own technologies and solutions as we continue to grow Digital.Health. So I'll just close that. I think the ability now in this age to connect folks to avatars, leveraging data and insights, is going to get more and more exciting. It's at a time for all of us to reinvent and move us from now to near to next, and not wait for the future to arrive, but to build it together. So with that short preamble, I'm going to hand it over to my friend and fellow Aspen colleague, Edmundo Robinson, who is an amazing individual. As you'll hear, I'll let him introduce himself. He's the founder and CEO of Down East Digital, to share some deeper insights and knowledge. Over to you, Edmundo.
Thank you very much. Let me get my sharing situation on here. See if this and full screen move there. Okay. So great intro, and I'm just gonna give a couple of slides to dig into a subset of what Daniel's saying around the intersection of digital health and health disparities. So Edmundo Robinson, founder CEO of Down East Digital. I'm a professor of medicine and oncological sciences at the University of South Florida. I do still see patients as an academic hospitalist at the Moffitt Cancer Center, but I spend most of my time, again, at that intersection of how do you leverage digital to really drive and accelerate the quest for equitable outcomes for all, across the board. So that process and that kind of theme is really what drives the work that I do now. And so I created Down East Digital to change the narrative a little bit around where digital can go, right? So what we often see is, really cool stuff, right? Oh, there's all this AI. We're gonna, all these different things. But what I've seen in, having taken care of patients for as long as I have now, in my third decade, the same problems that we were learning about in medical school or even in undergrad, because that picture of the barbershop reminded me that was some of my first clinical exposure was actually volunteering at a local barbershop to do blood pressure screenings when I was in college. The same challenge that we were having back then in terms of the outcomes for particular populations are still here. But there's an opportunity here to have digital really accelerate our quest to address those challenges. So brought Down East Digital together to, again, tackle what we see are the most challenging opportunities in healthcare. And that starts with health equity, in our opinion, right? So how do we use digital technology to navigate those challenges, those obstacles, the complexity, and accelerate the work? And our approach is really bring together sharp minds and let's all lean in and figure this out together. Some of the folks actually that are part of this community are on this call. We have our tagline is really the 3 C's: community. Start with building a community of folks who are leaning in on this. Collaborate and build things together. And then capital. At the end of the day, we actually do need to build innovations and solutions that are going to work and last for the long term. And and certainly in this country, capital is the way to do so. The imperative here, these are numbers that you guys all have seen, you're going to be familiar with, but I'll just run and pick a couple of my favorites. Right. So this was the intro on Down East Digital. Again, I talked about 3 C's of community, collaborating, capital. Here's the where I left off here, and apologies for that. I was advancing, I didn't know you guys couldn't see it. And so again, we talk about maternal health, we talk about rural communities, and we talk about telehealth access. So again, some of these things that Daniel talked about during his intro, right? So we see these challenges, and this is one of my favorites, that the work that Deloitte did around really putting dollars to health inequities. And so they had a pretty robust approach to quantifying the cost of health inequities. $1 trillion in 2040, and that's not that far away, folks. $1 trillion. And this is before the big, beautiful bill passed, actually. So that number, I suspect, if all of the kind of components of that bill get operationalized, that number goes up or it moves sooner. Right. So it's not 2040, maybe it's 2035 or 2032. Right. So $1 trillion is a lot. And so one way to think about that $1 trillion is, one, it's a shame that, because that also, there's lives associated with that $1 trillion, right? So that's definitely suboptimal. Excuse me. Another way to think about that $1 trillion is, wow, that looks like a market gap, a market opportunity that could be addressed with digital solutions as a part of the overall armamentarium to address that $1 trillion gap. So here's some of those trends of where digital innovation is heading in terms of health disparities. So one is, and some of this I'll go through it quickly because some of this stuff Daniel's already touched on. So AI-driven solutions, right? So we talked about some of that, especially around delivering clinical and operational impact that again are focused on outcomes for underserved populations as they are identified. Accessibility and personalization, Daniel called that one out specifically, right? Where we're building solutions that are customized for diverse patient settings, communities. It's patient facing, but there's also clinical components, right? There's clinician facing personalization that actually will optimize the ability to serve underserved populations. Popping over to the other side, you've got your, give me one sec. You've got, narrowing the digital divide. You talk about broadband expansion. You talked about the satellite approach to that. How do you subsidize technology? Does that help you get, part of the way where you need to be in terms of addressing disparities? Value-based care is really accelerated with the appropriate implementation of digital solutions, including things like clinical decision support. Obviously, aspects around virtual care and virtual management make a lot of sense as well in a value-based care world, which obviously we're moving toward, maybe not as fast as we should, but we're still heading in that direction. And then data collection analytics. We hear about social determinants of health. You really think about predictive analytics, data-driven interventions that are going to be specifically targeting health disparities. That's where we're seeing a lot of activity and action and investment in. And a lot of the data is and analytics is underlying and drives a lot of the other pieces that we talk about here. So there's a digital strategy framework if you want to implement within your complex organization. A lot of us work in complex organizations, right? There's really an approach that is standardized around implementing digital strategy to address health disparities and really focus on health equity, right? So one, it should be part of your strategy, part of your core digital roadmap, not a separate initiative where you put it off to the side, right, and then check in on it every once in a while. It actually should be really a part of your organizational strategy. You really need to engage a broad coalition of folks, right? So your frontline users, obviously your management, as we talked about, as it's part of your strategy. You're really embedding metrics and performance evaluations across the enterprise. Really thinking about how do you manage innovation? How do you prioritize the innovative tools that you're bringing in terms of whether or not they're addressing these gaps and outcomes that you've identified that are important for the populations that you serve. Again, the data analytics always serves as a foundational component of any of this work. So implementing standardized approaches to that, creating your equity, your dashboards that actually track interventions, but also focus on outcomes, not just processes. We have a lot of process measures, and we're not paying enough attention to the actual outcomes at the end of the day. So that shift on the data analytics side needs to be emphasized here. And then accountability, right? Again, it goes back to leadership. It's not this, well, we hope, this is what we're seeing in AI. We talked about the pulse oximeter, for example. It's not, well, we're going to put this out there and we hope it doesn't hurt anyone. It's more like, no, we're going to create solutions that are actually going to address the disparities that we've identified, right? We're going to be purposeful and directive about how we bring in new tools and new solutions, not just put it out there and kind of do a do no harm approach. And so again, at Down East, we see this $1 trillion as a market opportunity. It's untapped market potential. There's a subset of the market that's not receiving the outcomes that they should, and that's a market gap that should be and can be addressed. You've got to focus on value, focus on the actual impact. But when you drive value to address that gap, that value is going to accrue somewhere, and that there's a return on that investment. So we really think about it as, you can do well and do good at the same time. How do you address that market gap of folks who are not getting the outcomes that they should be receiving? And how do you build long-term sustainable solutions to address those gaps? The complexities of doing that, often the complexity discussion is around Medicaid, right? Medicaid's hard. Okay. Well, those complexities actually provide you with an ability to be first to market. If you're not intimidated by the complexities, embrace them, understand them, address them, and use them to create that value and magnify that impact, then that could actually be a value driver for solution providers. So that's me. That's Brooke. Again, I wanted to kind of go quick so we can get into the panel, but and give that overview. But part of what I want to do here is I want to really shift our thinking from kind of a woe is me, we've got all these challenges in healthcare, to wait a minute, let's go figure out how to address these opportunities that are opened up now that we have new tools and emerging tools and solutions. Can we focus them on the communities that here to date have not had that kind of focus and that kind of attention? So thanks for giving me a couple minutes there.
Fantastic, amazing. Edmondo, you are not only a clinician innovator, you truly are a action-oriented, inspirational leader, really, right? You're making things happen. I love it. And, I think a resounding message here is to be purposeful in how we are designing technologies for all and with those who will be the end users of these solutions, right? So thank you for that. I don't know if there's any other thoughts here, or otherwise Daniel, do you have a thought?
Just one thought. Thanks for sharing all that. One challenge, of course, is you get what you measure. Are we measuring the right things? And then question number 2 would be, there's lots of emerging tools and solutions, but often they're fragmented. How do you think about bundling them together and also getting the communities and the folks who are the need knowers to help design those solutions and those sort of integrations?
Yeah. So are we measuring the right things? So let me take those great questions. Always. Are we measuring the right things? Probably not. Right. So part of the reason why what I talked about is when we do measure, the most advanced measuring around this challenge is often process focused. Right. And so that's why I wanted to really get us to yes, you do have to measure, right? You go back to Donabedian, right? So structured process outcomes. You actually do have to intervene in all of those, right? But at the end of the day, it's the outcomes that matter, and you've got to go as far to the outcome side of it as you can. And so that's one of it. Is how are you measuring your interventions? The other thing are, do you even understand? And so basics like upstream. Do you even understand where your challenges and opportunities are? Whether you're a provider or payer, do you actually understand? Have you really done the work, the homework, and the data analytics? I was just talking with a data analytics company earlier today. Have you built the data infrastructures to truly understand your population, and so that you can intervene and then track the interventions? So in many cases, the answer is no, unfortunately. But that's where we need to go. Okay, so that's why data and analytics is the foundational component of all of this work. Yes, there are a lot of fragmented solutions. I understand why there's fragmented solutions because the work is hard. And so when you have an early stage company, you need to focus on the thing that you know how to do, right? But when you're a payer or a provider where you've got all of these challenges and you've got one little point solution that's going to solve that one, that's definitely a big challenge. But so having been on both sides of that equation, I will say that on the, let's call it the customer side, the ones that are buying these solutions, it does help to be able to clearly articulate what your priorities are. What problem are you trying to solve? What problem are you trying to solve? That way you can actually refine, one, you can refine the solution set of folks that you're gonna engage with. And two, you can help line them up to be a part of your overall tech platform, so that where do they slot in, right? So part of your responsibility as a customer, quite frankly, is to build, one, again, prioritize what, your strategic imperatives, and two, build a tech platform that allows the point solution providers to slot in, and so that they can be part of your solution. Now, the innovators need to understand how to slot in, and not feel that they have to do all the things. If you're brought in, do the thing that you're brought in to do it well. And if when you find that nexus of the great innovator and the great customer, it's really sweet when that happens. It's unfortunately rare, but it's really sweet when you see that happen.
Amazing. Thank you so much. Once again, great to kick us off with, and for us to transition now into our panel discussion that'll be moderated by Dr. Daniel Kraft and Dr. Armando Robinson. I welcome you to stay here on stage, and I'd love to invite Dr. Tanisha Hill to join us. She is the incredible, amazing CEO of Digital Health for Equitable Health and the CEO for Curate Health. And, she's extremely prolific. I do not know how she does all she does, but we're so grateful to her leadership over several decades here at the intersection of health and technology. So welcome, Tanisha. And Yamilet Payano, our amazing CEO of SignSpeak. Thank you so much, and the inspiration for today's panel discussion. So thank you so much for your leadership in really helping to bridge gaps and make all communications accessible to all people. And really excited that you are now bridging over into healthcare as well. So welcome, Yami. Daniel? It's all yours.
Perfect. Thanks.
Engage in the discussion. I'll come back when it's
Great.
time for Q&A and closing remarks.
Great. Thanks. Really excited to have this conversation, and I think I'm just going to let our esteemed panelists introduce themselves and share a little bit at the beginning about what they see as some of the real world success stories and tackling those challenges and what their vision is for the future. And I think Yamilet from SignSpeak is a great example of building those solutions. So I think we'll start with her. And she's going to share some of her background and what they're doing there and what she sees are the opportunities for what's next.
Well, thank you, Daniel, and hello, everybody. I'm super excited to be part of this panel. My name is Yamilet Payano. I'm CEO and co-founder of SignSpeak. At SignSpeak, we use artificial intelligence to really bring about two innovations. So sign language recognition, sign to voice, and then vice versa, voice back to sign language using a digital avatar. And I'll give you guys a demo of sort of how that looks like, just so that it's a more visual sort of product. And I'll give some of the folks time to rearrange their screens if they're looking at the interpreter. So I'll give a couple of seconds. And I'm going to walk you guys through our app. So essentially the way that it works is this is on a phone. You'll read the terms and conditions like always, enable camera. And then this person right here is our avatar. And then you see the self view. That is the deaf person. As you can see, the hearing person can talk, and then that starts being translated by the avatar in real time. The deaf person then can start signing, and then that is translated to the hearing person and voice out for them in real time. Now, as you guys can see, there's different modalities to the app. There's not just the avatar, but also closed captioning for those that might prefer closed captioning and might be hard of hearing later in life. We also do have a backbone of human interpreters as well. So let's say that there is a conversation that needs escalation. All the user have to do is hit the human button, and that would be transfer out to a human interpreter as well. The main issue that we started this platform for is we have a deaf co-founder. I have a deaf family member, originated from the Dominican Republic. So if we think that access is super hard in the United States, you can only imagine abroad. There's just a limited set of interpreters in the United States, and also pricing sometimes is limited to get them. So we really thought about combining artificial intelligence. To go back to Daniel's point, it's not about replacing, it's about enhancing services. So with this new approach of AI with humans, right, we think and we are seeing by our early deployments, our early customers, that the deaf community now do not have to sit and wait hours and hours to get an interpreter and accessibility. Now people are actually being able to engage. So providers that might not, let's talk about small clinics, right? Let's talk about the little guys in the stories. Well, now they weren't able to provide interpreters because the cost was a little bit out of reach. Well, now with this new solution, they can provide accessibility. Well, we are known for American Sign Language. We do also have 23 other languages as well, with representative avatars too. And before I pass it on back to Daniel and my other esteemed panelists, I'll stop sharing screen now. What I wanted to say is that accessibility, when we're thinking accessibility of all, we usually think of race and all that stuff, and usually we don't think about accessibility. But when we think about real world impact, think about everything that has come out of accessibility. The digital toothbrush that we all use, at least I know, actually started for people that have limited mobility. When we think about curve cuts in the sidewalks, we're thinking about wheelchair users. Well, now that is used for delivery guides, right? Women that are pregnant and with strollers. Think about all that stuff. When we think about closed captioning, right? Or audiobooks that started for low vision and blind people. I know I get all my information through audiobooks nowadays. So really thinking about the impact that this has, right? When we're thinking about the ROI of designing with inclusion in mind, it's really a benefit for everyone in this room and beyond because we are starting with that inclusion and design in mind. So I'm really excited to be part of this panel, and talk a little bit about innovations that are coming, that have come in the past historically. And yeah, super, super excited to be here. So let me pass it back to you, Daniel.
First, fantastic work. That's so impressive. I love that sort of blending of the avatar and real time. Maybe just give a short take on how has that accelerated in the last couple of years with AI, and where do you see it going next? And of course, sometimes for folks with hearing disabilities, it might also be the buzzing and vibration, other ways of communicating beyond the visual. How do you see those things coming together?
That's a fantastic question. So, deafness and deaf and hard of hearing is a spectrum. There's about 48 million deaf and hard of hearing in the US. We're only seeing that increasing over the years as AI gets better, as technologies. Daniel was talking about wearables. We were talking about data and analytics, right? Once we start seeing all of these technology comes to life, what we're going to have is longer life expectancies. When you have longer life expectancies, what you probably are going to have is that we are in this room are more likely to suffer a disability in our lifetime, whether that might be hearing loss, mobility, etc. So what I'm actually expecting to see is you're going to have that diversity of sort of like a spectrum of hearing loss, and people are going to need different things. That is why ScienceSpeak really are focusing on an all-inclusive platform, similar like Zoom. If you don't need captioning, you don't need to turn it on, right? If you don't need to pin the interpreter, you don't need to pin it. But having the ability to have closed captioning in one, to have the avatar in another, because what I love about my product is that I've had women telling me it's really uncomfortable to have a meeting with my OBGYN with another third human in the room. And now with AI, I can have that private information and it is my voice. I'm choosing the words, and the AI is giving me factual translation rather than being and discussing things with my OBGYN that I don't want a third person to have. So what I actually am seeing is that we just need to give consumers the choice. At the end of the day, all these technologies, what we're doing is creating more choice for the individual, reduce the price so that people that were left out of conversations and opportunities and ability to get healthcare, now they have other tools to do so. And I think that that is where I see AI helping. That's really where I see the trend, is that AI is going to allow us to personalize our own experiences with our doctors, with our providers in a way that we haven't seen before at a lesser point.
You know, I'm not supposed to come on back on stage right now, but I am just so excited about everything you're saying. And I just a round of applause. Yami, amazing. Thank you so much for what you're doing. Incredible work. Okay, I'll go backstage.
Thanks. I think applause for deaf is this, right? That's I think
Yes,
that's how you do it,
yes,
right? Which is awesome.
yes.
Thanks for sharing that. Before we jump into our discussion, over to Tanisha Hill. You've been at this intersection of health access equity to pharma and big systems. What are your top takeaways and thoughts for what's now and next?
Yeah, you're right, Daniel. Thanks. I have been all over. I currently lead a digital team for a large pharmaceutical company, so I have to give the disclaimer. These thoughts are my own. And I am an overachiever and very passionate about digital health. So I did start Digital Health for Equitable Health. Our focus is on policy, and it's been up and running for several years now. And we do policy because everyone has these fantastic ideas about implementation, or they have interventions like Yamis, for example. But if you don't actually have coverage, right, reimbursement, you're a clinician, you know what that's like in the office when you've had patients and you really want to get them a therapy, whether it be digital or traditional, and you can't do that. So our goal is really focused on policy. We really want to make sure that there are policies available for people to have access, equal access to these types of technology. So that's number one, primarily for me in terms of future. That's really where I'd like to see us go, where digital health is totally transformed into our existing healthcare system. And in the work that I've done in this space, legislators, we've seen bills that are bipartisan, bicameral. There's a lot of interest. So that's always promising. And we continue to advocate for those types of tools and technologies. I think the other thing for me in terms of the future is the North Star is that equity is by design, right? That it's not just everything we do, everyone has some way of being considered in the development process from day one, whether that means you get focus groups together or, reach out to people that or institutions. I oftentimes, when I'm doing these types of podcasts, I'll recommend startups, people who are creating, innovators who are creating these technologies to reach out to the academic institutions. They are oftentimes wonderfully considerate, want to help move this forward, and will do clinical studies even in this space. So I've had that experience so far. So I do think that, the future is digital. And when I think about equity, I shared this with Yami too some time ago and earlier. I think we oftentimes think of equity only for the underserved populations, those who are marginalized. That's the first thing we think about when we consider equity. But even when I was doing my own website, for example, we just launched Curate Health, which I think is launched today officially. It is a for-profit organization that's out there. Again, the passion is to help innovators move from end to end, right? From development all the way through regulatory processes, all the way to access with payers, to get engagement from patients. I've had all that experience. And even just doing my own website, I had to be very particular about access. I had to go back and do, accessibility checks, make sure my fonts were the right size. People are often hearing impaired, visually impaired, or even cognitively impaired. And so I oftentimes, and even now in the future, I think the first thing we can do, future meaning like tomorrow or even later today, just check your websites, right? We all have companies or our own personal websites. Just make sure that they do an accessibility audit and make sure that they are available to everyone. I think we can start there. But the North Star for me, the future is equity for all, equity by design.
Thanks so much. You mentioned this policy piece, and now we have, when you build a new building to code, it has to have ADA accessibility in the ramp for folks who are wheelchair bound, for example. What might be some examples where policy can drive that when you launch an app, or maybe you have to regulate it through Apple or Google Play Store, that it has visual elements or auditory elements or other elements for folks who have some level of accessibility challenge?
Yeah, so I'm so glad you asked that because there's still not a lot of standardization. There's still not a lot of uncertainty in that space. What are we talking about when it comes to policies, right? So of course there's policies around safeguarding data and that we're still working through. But what we advocate for is policies related to accessibility primarily at DHEH, at Digital Health for Equitable Health. And because this is still a new space, and I have worked directly with the FDA on this, I think, and our legislators, I think there's still some lack of clarity to answer your question about what this would look like. So I give you an example. When I started DHEH, we have a fabulous company, a law firm that advocates for us. And were sitting in front of the folks who created legislation, and they said they didn't necessarily, this was a couple years ago, mind you, want to approve apps that were gamified. And I think that, that in and of itself is a barrier, right? So the reason I'm bringing this up is because it's still not quite clear to answer your question. I think what we need for clarity is more people to start asking those questions, but more importantly, to start advocating. We at DHEH, we're really trying to bring the masses together. It's a 15-member organization. We have all four historically Black college and university representation. We have American Cancer Society. We need individuals, we need patients to say, this is what I need. We need healthcare providers who are in front of the patients to say, this is what we need to help our patients. Payers, we need the entire health ecosystem to start driving, Daniel, an understanding of, basically to ask your question, what are the policies that need to be in place? Right now, what we were advocating for is digital therapeutics and telehealth. To be more concrete, that's where we are today. But I think in the future, the community needs to drive the policy. And have our leaders, that's why they're there, right? To speak on behalf of the community. So,
And related to policy, there's I love this phrase, we don't practice evidence or need-based medicine, we practice reimbursement-based medicine. So it comes back to how things get funded and incentivized. And Mundo, you're at the intersection of that. How do you see that intersecting, not just sort of the equity side, but maybe the accessibility component, which of course blends together?
Yeah, so so Tanisha said, so the policy drives the reimbursement. So it's certainly at the larger scale, right? Even the commercial payers follow CMS. But I think the broader picture here. So that's just a truism, certainly in this country. So we should that should just be first statement. But I think the other opportunity here is, as you navigate the policies and even influence the policies to get these things paid for the way they should be, I feel strongly that long-term sustainable solutions in this space around accessibility, around equity, are market-driven. I think you have to build solutions that are going to stand the test of time through markets. That means you actually have to have business plans and EBITDA. I want to buy a shirt that says "Show me your EBITDA," right? Like that's how I want to approach this, because then you'll be able to navigate the challenges that come through, and build great companies and solve challenging problems. And so I feel like lining your policy, your reimbursement strategy, and your tech stack with your overall approach to how you're going to solve these problems around accessibility and equity is the way to go. In that, I think again where we're going to see long term traction.
Daniel, can I just
100%.
piggyback on that, if you don't mind?
Please
So
go.
I think it just has me thinking, and I mentioned this before, it has me thinking, why are we even having this conversation, right? Why are we even talking about digital health that's accessible for all and equitable for all? And it's really because if you think about it, 80% of chronic diseases in the United States are driven by healthcare behavior. And we're over 4 trillion now in terms of health expenditures here in the US back in 2023. So we're spending a lot of money here in the United States on chronic diseases, especially that we could change with health behavior change. And digital health is at the forefront of that. We have technologies that are trigger based, they have, incentives to help move behavior change. And so for me, digital health, it drives the behavior change that we need to get people healthy to go to work, to get people healthy to continue to maintain our national security. It for me is a public health imperative. Using digital health at this point for healthcare transformation is a public health imperative. I think it affects our fiscal status. I think it affects the overall public health. And I think when we think equity, it doesn't just mean, it means everyone should have access to be able to come to work and do the right thing and be healthy, have healthy families, live really great lives. And so I oftentimes get the ROI question too when I have these conversations. And for me, that's what it is. We have to think about the big picture, the overall impact. And if you, oftentimes what I see too, and why I built Curate Health is because people have fantastic ideas, bold innovations. But if folks don't get access to them, then they aren't generating revenue, right? And they can continue to generate new research, new ideas, new innovations. So it's a cycle. And so I think I hope if when we walk away from this discussion, that people start thinking about the entire ecosystem and how equity or access for all really impacts the way we live as a community.
Right, and to learn for those who are building it. So I mean, maybe I was going to pivot to Yamle on with ScienceSpeak. What are some of the lessons you've learned in building a successful platform? How have you engaged the hearing community or the deaf community to help design for that? And what challenges and barriers do you see that maybe our digital health community and the folks on this call can help address?
Oh my God, I don't even know where to start because there is, I think, I want to focus on the opportunities, right? I think, first of all, we were born by the community. So one of our co-founders is deaf. Our second co-founder is an interpreter, comes from an interpreter background, understands AI. And then I have a family member who's deaf and understand the policy and sort of all that stuff. So when we started ScienceSpeak, we really started with the deaf consumer in mind and understanding that we needed to build not for but with the deaf community. So a lot of our efforts have actually been, we've been building this for 9 years, and research and development is no joke, folks, okay? Especially when you're developing with intentionality. And I think that that is where programs like the SBIR comes in, grant writing comes in. But I also will encourage big players or people that are in the room or providers to also develop pilot programs, right? And like keeping these, when we're talking about inclusive design, like it's very different me building in a lab or me building with the deaf community than now actually putting it in practice in a provider's place, right? Like those are three different stages of testing, and it needs to be done really methodical. So I think that when I'm looking at this crowd and what people can do, I think one is pilot programs and being more open to testing these technologies out and providing a little bit of budget. I think a lot of people expect startups to just be like, yep, we're going to do it for free. And like there is a lot of love and labor that goes into putting something in place and sending your people out there to make sure that the deployment goes well. So that is one area where I wish I could see more collaboration of is how do we make it easy to run tests within digital health? Yes, policy matters. Don't get me wrong, reimbursement matters, all that matters. But if we were to focus on the need and going back to a need health system, being able to say, you know what, let me carve out a budget of X amount to test a new innovation. Because the thing is, the policies are not going to move without data, right? So what ends up happening is that we're excluding a lot of voices because what's getting is yes, it's getting cheaper to build these platforms. Don't get me wrong. Like it's cheaper to build an AI, it's cheap to test with the community, but it's not so cheap to implement it within the healthcare system.
Yeah, not at all.
And I think that that is where we have a big disconnect. And that's where we are losing a lot of the voices because then you have people and teams built for the deaf community, built for X community here. And what ended up happening is we don't have access to those big budgets to then be able to push policy and data driven results. And the government, what we've seen is won't move without data. I mean, and that's where we've been for many years on digital therapeutics, right? I mean, we've seen the apps, but it's like we need more data, we need more data, we need more data. So thinking sustainably, going back to the EBITDA question of like, how can we make sure that R&D products can stay and sustain the time, and how can we invest in diverse teams that actually come from these communities? Those are the two main hurdles that I think I've had is like we want to build faster and bigger, but sometimes budget and pilots and people being open to pilots, I think it's a little bit limiting for people that don't have the connections or the access to do it.
So, Dan, let me follow up on that. It's such an important point that Yami's bringing up, right? This idea. So you want to go from your early concepts, you're building in the community to scale, right? And then the hardest folks to sell to in healthcare are the providers, right? Especially, I mean, in a lot of these big providers, they've got tiny margins, 1%. Yeah, it's 1% on a few billion sometimes, but it's still 1% margin, right? So this is why I go back to the point I made earlier, which is it's incumbent upon the providers and the payers, the customers again of these kinds of solutions, to figure out what you want, right? And so because what I've seen with some of these pilots is they're like, oh, that sounds cool, I'll bring that pilot in, and then like something shifts because it wasn't really a high priority, and then you just leave that company just like hanging in the wind, right? And so start with what are your priorities, and if figuring this accessibility is a high enough priority, then bring ScienceSpeak in and put them in a pilot. And not only do you put them in a pilot, you build your contract so that if they hit their pilot metrics, then you've already built scale into the contract. So they go straight from pilot to scale immediately without having to go through a whole other process and go back through legal and contracting and all that stuff. It's already built up from the very beginning. That's the responsibility of the customers to actually make that happen. This is how you get from concept to scale for solutions that are really going to matter for folks.
Yes.
So to scale this, you need to often educate the providers, the policymakers. There seems like as things accelerate, there's a challenge of getting folks on board, understanding what's here now and what's coming next, and integrating that into a solution set that isn't scattered. Maybe Tanisha, have you seen some successful examples of this that you don't have death by pilot, right? That's often the moniker. You end up with stressing the team to try things in so many places where these could kind of go across an entire Kaiser or VA system or others.
Yeah, so I have done it since 2016. We launched 3, and this is just my background. We launched 3 fully enabled inhalers in a respiratory community with physicians, payers, the healthcare systems, the integrated delivery networks. It is a challenge. I think what I learned since 2016 is that it's really about integration. It's implementation. I don't think the passion is lacking. I don't think that they're always looking, even the payer system, we've been working with them forever. They're always looking for new technologies, but they do their HTAs, right? The health technology assessment, and they look at them against the ROI. When we launched the products, it was tough at first, but we did get coverage. We got about 40% of lives covered, believe it or not. And so the payer system took the risk. They took the chance because they understood the importance of digital health technologies. And so I think sometimes they get a bad rep when it comes to, digital, but of course, at the end of the day, they have to consider the ROI. It was the implementation. The HCPs, the healthcare providers, as passionate as they were, that was a rate limiting step, believe it or not. to prescribing. People have to actually use, this happened to be a prescribing model, but it's not the only one that we've been working with. People actually have to find a way that these technologies are integratable, to Yami's point, where you're not really uprooting or making significant change in the healthcare system. We were coming off at the time, the heels of the pandemic. But I think today, what I've seen evolve since 2016 is that, to Armando's point, people are showing their passion. They are sort of testing these. There's still not a lot, which is why what you all are doing, the work that you and Risa are doing is so important. Just labeling out, putting out there what technologies are even available. People don't even know, right? So that to me is the first step. But we can make the change as long as we start building more awareness. I think awareness and then education is, people are there. I think in terms of stages of behavior change, there are people who are passionate in all walks of life, healthcare providers, the payer community. But now we need to build more awareness, I think, so that they can do what Armando says, pick your priorities, right? So that's just my thoughts.
And if I can say one thing, and I see it a little bit on the chat, I think that for people that want to start small, a lot of like startups actually have some kind of out of the box experience. So if, let's say you're a member, or you're a pharmacist, a technician, whatever it is, and you see a product that you like, try to even inquire about, hey, is there an out of the box experience for this therapeutic, for this digital health platform that I could use? Because once a person starts using it within the context of whatever use case you're looking at, what you're going to end up seeing it is like more people in the office start seeing it, and then you can go upper in management as well. So I think that there's a beauty in like top down and bottom up approach, where like you as an individual in this call can definitely like bring in some of these technologies at a smaller scale so that you can try it themselves and maybe encourage others in the office to do the same. So just wanted to add that.
Risa, over to you.
Okay, wonderful. Well, thank you all for such an engaging, insightful discussion. Truly an important topic. As you said, Dr. Tanisha Hill, right? Really important that, when it comes to designing, that we're designing for all, designing for equity. Dr. Armando Robinson, you pointed out, right? Policy drives reimbursement, right? Like all of these things are interconnected. Yami, you're doing the important work. So are others on this call. All I can say is I really like when there's like a one first step that's easy. And I like that, Tanisha, you said, go to your websites and just make sure that they're accessible. Like that's a first step. I love that you guys talked about piloting ideas. Start somewhere. I think that's the whole thing, is that, and let's not be silent on this. This is really important. And really loved how Yami was sharing that a lot of things that we built for specific populations ended up benefiting the entire population. So that's where a lot of innovation comes. So the ROI, zoom out and think of the kind of the global opportunity here. I just want to thank each of you from the bottom of my heart for joining us today, and for the important work you're leading. And to those of you who joined us in the Digital.Health community and beyond, hope you enjoyed our studio series. We welcome you to continue joining us each month. If you haven't already, sign up on Digital.Health. It's a really easy URL. It's Digital.Health. And then you can start exploring for free and learn about so many amazing digital health technologies that are out there, including SignSpeak. Compare them and share them out. I think the big first thing is just learning about what solutions are out there and start to bring them and test them in your practice, and continue to expand from there. Yeah, I think I'll close there with one more time. A big thank you to those who joined us today. Big thanks to Dr. Robinson, Dr. Hill, Yami, Dr. Kraft, and our amazing sign language interpreter from SignSpeak, such a beautiful language. And join us each episode as we learn, share, care together. Thank you.